Stroke is defined as a syndrome of rapid onset neurological deficit caused by focal cerebral, spinal, or retinal infarction or hemorrhage. It is a serious life-threatening medical condition which happens when the blood supply to a part of the brain is cut off. Like all other organs, the brain also needs oxygen and nutrients to maintain its normal functions. Therefore, if the blood supply to the brain is compromised, brain cells begin to die. Based on the etiology, there are two major types of strokes. Ischemic stroke, which occurs due to blood vessel obstruction, accounts for about 85% of all the cases of stroke. Obstruction can occur due to thrombosis, or formation of blood clots in the vasculature, large artery stenosis, and small vessel disease. Hemorrhagic stroke, on the other hand, occurs when a weakened blood vessel supplying the brain bursts and subsequently bleeds into the area. Hemorrhagic strokes account for around 10% of all the cases of stroke. Common instances where hemorrhagic strokes can occur include head trauma, uncontrolled high blood pressure, overdosing of anticoagulant drugs, ruptured brain aneurysms, and cerebral amyloid angiopathy. Approximately 5% of strokes are caused by other diseases like arterial dissection, venous sinus thrombosis, and vasculitis. There is also a related condition called transient ischemic attack, or TIA, where the blood supply to the brain is temporarily interrupted. This causes what is known as a mini-stroke. It can last a few minutes or persist up to 24 hours. Transient ischemic attacks are often a warning sign of having a full stroke in near future. Therefore, these patients should be evaluated to prevent such events. Several factors contribute to an increased risk of stroke, including the following: obesity, physical inactivity, alcohol consumption and smoking, use of illegal drugs such as cocaine and methamphetamine, high blood pressure, high blood cholesterol levels, uncontrolled diabetes, obstructive sleep apnea, cardiovascular diseases such as atrial fibrillation, heart failure and heart defects, family history of strokes, increasing age, male gender, and certain medications such as hormonal birth control pills. Signs and symptoms of a stroke depends on which part of the brain is affected. Following are some important signs and symptoms of a stroke: speaking difficulties and slurred speech, inability to understand what others say, also known as inability to comprehend, paralysis or numbness of the face, arms, or legs. This often affects just one side of the body. In addition, one side of the mouth may drop when the patient is trying to smile. Vision problems such as blurred vision and double vision may also occur. Moreover, many patients experience a sudden, severe headache which may be accompanied by vomiting, dizziness, and altered consciousness.